bone health and also the postmenopausal part of your physical. So in a perimenopausal, menopausal phase, there's a couple of things you add to the health tips for women to check out.
Well, perimenopause is a transition period, and some women have trouble defining it, or they walk in and say, I don't know, am I perimenopausal, am I menopausal?
I could define it.
It's fluctuating hormones. Right. But that translates into irregular menstrual cycles.
Right.
And then they usually have some hot flashes or warm flushes, whatever, the night sweats, they're just uncomfortable.
Right.
And then we do blood work.
But again, things that in that phase, late 40s, early 50s, I guess you begin to concentrate a little bit about cardiovascular disease.
Totally, but I'm GYN.
I know, but
no,
would
we talk about blood. We check blood pressure. We do a lipid profile.
Right.
We check for diabetes.
A little bit.
That's a lipid
make
profile.
Sure that they
Absolutely.
Make sure that they get a cardiac physical.
And they're doing some exercise, and their weight is appropriate.
And bone densitometry, do you do?
I send them for. We don't do anything. We send them to the radiologist. They do bone density when they're getting near perimenopause, menopause. It depends on how irregular cycles are.
What's your feeling on the whole calcium, vitamin D controversy?
You mean in 20 minutes of sun a day as well? The problem is the studies are not showing that calcium and vitamin D really are great. They're pushing it, but then it's not. You want vitamin D so your bone builds, but in terms of rebuilding bone, it's not turning out to be the be-all and end-all.
Right.
But neither is the bone rebuilding medication. It's coming with a lot of issues and problems. So I think at this point, estrogen needs to be somewhat considered.
I totally agree with you.
See, because estrogen prevents bone loss.
Right.
So you don't have to rebuild it.
I had an old professor that said to me, Dr. A, trust me when I tell you estrogen is the window
it's wonderful.
For women. And let me tell you, my mother's 80-something years old nowadays. And I remember when she went into menopause, whatever it was, 30 years ago, I gave her estrogen for almost 15 years. And her bones are like dense as anything, and you know she'll die of something else, but she ain't gonna.
Everyone dies of something.
Yeah, but she's not gonna die from a broken hip, I don't think, and I hope not. Last question I have for you: vaccinations. What kind of vaccines do you recommend for women?
Well, I recommend the Gardasil vaccine, okay, and of course the flu vaccine CDC recommends for every year. I don't push vaccines. I encourage patients to go to a primary care doctor. They might need a tetanus shot. They might need updates on some other vaccines.
Okay. And you know, again, being that the, and I know you're not a cardiologist, but being that cardiovascular disease is one of the
biggest killer
for women, how do you, aside from, how do you, from a holistic perspective, you being a midwife, so you do a lot of holistic, what do you advise women? What are the things that you tell women to do in order to keep a healthy heart?
I try and encourage exercise, and that's a hard sell if it doesn't fit in with your lifestyle. Mm-hmm. So I encourage them to get a pair of sneakers and walk briskly 30 minutes a day for 3 to 5 days a week. Start out on the weekend, do Saturday, Sunday, and 1 day during the week. And as you build up, you might get in a 4th or 5th day. And they seem to be receptive to that. That's the least difficult to fit in.
Right.
And after that, they usually feel better, and hopefully they'll start eating better and losing a little weight, and then they get very encouraged and they do more.
Right.
But it's a hard sell sometimes.
Right. And smoking?
No, I'm totally anti-cigarettes. Totally anti-cigarettes.
You don't want her.
You don't want
you don't want her jumping on your case with cigarettes.
Not at all. Cigarettes, diabetes, weight loss. It's real. All of this is very important. Yeah, it's a total package.
All right. Well, thank you so much for coming to the program. Do we have a website that people can go and read your stuff?
AskYourMidwife.com.
AskYourMidwife.com. For the thousands of people that are looking for a midwife, there you have it. I am bringing you the guru of midwifery here in New York City. All right.
Thank you very much.
Thank you.